Hi, I'm Dr. Rob. This week we're going to be talking about runner's knee and the Alter G Treadmill.
It's used to describe several conditions of the knee, where a lot of times it's a pain underneath the kneecap, can be pain on the top of the knee, or even pain in the patellar tendon where the kneecap attaches to the lower leg. It's kind of used as a blanket statement a lot of times, where like runner's knee, jumper's knee, or like patellofemoral pain disorders, they would all kind of fall into something like that. People who are running considerable miles will be more at risk with this, but anyone who's doing anything with like extended bending of the knee, so extended walking, biking, even certain weightlifting exercises, all of these people will be at risk for something like this. You're not really going to get anywhere with training through it. You've got to do some rehab with it, with stretching certain areas, even like icing after runs is going to be beneficial. Like the rest, compression, ice, elevation, those are all going to be things you can do at home to keep it from getting worse, but it's not something you can necessarily just run through. You have to loosen tight muscles and strengthen some of the weak stabilizing muscles. In the office, we'd be looking at like how the foot works, how the hip works. Be looking at like tightness in the front of the leg and the quads. You're usually going to find a lot of tightness in the quads with it. So we would do probably some Graston or ART, things like that on the knee itself. We would probably do some cold laser. We could even do like the Alter G to kind of if we were trying to run through it, the Alter G would be better because you're not having as much impact on the knee. It's really going to depend person to person. You want to know what kind of activities this person's doing to begin with. Some people, it's really hard to get them to rest when things are flamed up, and then they just keep kind of working through it, even though all you're trying to get them to do is slow down and not keep abusing their knee. But with people like that, it does take a little bit longer.
Hi, I'm Rainey. Welcome to this week's Fitbit. This week we're talking about runner's knee. Runner's knee can be caused from your patella or your kneecap, causing irritation at the point where it meets your femur or your thigh bone here. And that's when you feel the pain. So what might be causing this? A couple things can be blamed. Tight hamstrings, so make sure to really stretch those out real good. But what I'm going to focus on today is working with your quad. So having a weak quad muscle, what's happening with that is if it's not strong enough to support the kneecap, the kneecap is going to tend to kind of like slide out of alignment, and that's when you get that irritation and feel that pain. So I'm going to show you 3 different ways that we can strengthen the quad. Pretty simple ways too. You can just do these at home. I am doing them today with ankle weights just to make it a little bit harder. You don't have to use the ankle weights if you want to try it without first, just to see how hard it is not having extra weight added on. So what you're going to do is just kind of like lay back flat, and I'm just going to basically do a leg raise. So I'm going to keep my leg straight, and I'm just going to raise it up straight until I get about perpendicular, or 90 degrees. And I'm going to lower back down, and raise it, and lower it, just like that. So this one is working with the whole muscle, the quad as a whole. So I'm feeling it all over through here in the front of my thigh. All right, so then the next one, what I'm going to do is point my toe out away from my body like this, and then I'm going to do the same thing. So I'm raising it up and down, just like that. So what this one is doing is working the inside of the quad. So I'm feeling it here on the inside of my leg. Just up and down, same thing. All right, and then the last one is to point my toe towards my other leg, the opposite direction, and do the same thing. So this one's going to be felt out here on the outside of your leg. So the ones that are pointing your toe out or in are a little more difficult. So just raise it up, as best you can. If you can't get it all the way up, if that seems really hard, just do it as much as you can. If it also causes your a little pain in your low back to lay flat like this, another way to do it would be to kind of rest back onto your elbows like this. You might not get it perpendicular. Just raise it again as high as you can get it on all of them. All right. So pretty simple movements. I mean, you can do, like I was saying, you can do these at home. If you want to get ankle weights, you can purchase them at like any sporting goods store or in any sporting goods section of a store. They're pretty cheap, and you can get various weights also. I suggest start pretty light. Like these ones that I'm using are just 2.5. But I also would recommend to do 10 reps of each. So 10 reps with your legs straight, toe pointed out 10, toe pointed in 10, and then do 3 sets. Make sure that you're doing it on both legs, not just the leg that may be causing the pain. You don't want to have one quad that's stronger than the other, because then the other knee might start to hurt as well. All right, so that's been this week's Fitbit, and we'll see you next time.
All right, so we're going to talk about the Alter G. This is something that can be really helpful with someone who's having problems with their knees but wanted to continue training. So if they were going to continue running like through an injury, something like that, the less compressive force we can have on it, the better that person's going to do. For someone, if they're in the middle of like training for a race or something like that, who doesn't want to take the time off, they could run on this instead, where they're not going to do as much damage to their joints, but they can keep up with their cardio and conditioning and things like that. Short distance runner, it would, because as far as like how often we would use it, that would kind of depend on the person, how they run now and what their goals really are. Mm-hmm. So if it was somebody who, it was just like, say they were trying to get back into running, things like that, that'd be something really good too, just because when you're starting to get back into it, your joints aren't necessarily used to all the force that you're going to put on them. So you can kind of ease into it a little bit more and more, controlling how much weight you really put on. If you can unload the joint to where they're able to run and not feel any pain, whereas like say if they're just walking, they have pain, I'd probably start them where you get to where it's completely painless to do the movement, then slowly kind of increasing the pressure, putting more and more on them so that you can just build up that tissue tolerance to it.
To submit a question, watch a past episode, or to find out more about the Springfield Wellness Center, check us out on Facebook, subscribe to our YouTube channel, or find us on Instagram, or check out our show website at wellnesslab.tv.